CBS News medical contributor Dr. David Agus joins us for more on this vaccine breakthrough. Doctor, the news crossed just after 9 p.m. last night. What's your reaction and what's next?
This is it, right? Finally, there is light at the end of the tunnel. We're going to go on offense against this virus, and that is exciting. Science is coming through here. That being said, the task of vaccinating 300+ million people in the United States is a daunting one. And especially this vaccine has to be stored at -94 degrees Fahrenheit. So it's being distributed across the country now, and there are going to be programs in every state. Each state has its own requirement for who will be vaccinated first, but it's beginning.
Alex Azar, the Secretary of Health and Human Services, says that the vaccine could be available as early as Monday or Tuesday. That's the good news. But with healthcare workers surely on the front lines of those who will be getting this vaccine, who's next in line and how quickly before regular folk are in that number?
So healthcare workers will get it over the next many weeks. Remember, the first shipment of several million doses is a fraction of what's needed for healthcare workers and people in long-term care facilities. Next are going to be people with medical issues. So these are people who are higher risk for complications for being hospitalized, because as of now, we all know that around the country, ICUs are filling up or full in many places. So we have to protect people who would be hospitalized. And then we'll go to the rest of the country. So really, over the next 6 months, we're going to vaccinate everybody. It's going to take time, and as everyone keeps alluding, wear that mask, buy time so we can stop spread the virus and we can win this war.
We've heard recently about potential side effects maybe for people that have severe allergies. And then there have been questions about ages and who can get this vaccine, how young, is it 16 or 18? Give us some sense of any restrictions or warnings we may see early on.
Initially, it's 16 and over. It hasn't really been tested in young children, and that's ongoing now. And rightfully so, they test later to make sure it's safe first in adults. There were 2 cases in healthcare workers of a reaction, an allergic reaction to the vaccine, which is not uncommon. It has been seen in almost every vaccine. If you have a history of allergies or have EpiPens so that you know it's a severe one, you probably shouldn't get it in the beginning. And then there are the pregnant women or nursing women. Both of them it hasn't been tested in. Major issue in that the majority of healthcare frontline workers are women, and some of them can be pregnant either knowingly or unknowingly. And so that's an issue we're paying close attention to.
We're paying close attention to it all, Dr. Agus, and thank you for being our telescope. Thank you.